Good morning, good afternoon. I'm going to start with hospitalisation numbers today. As Omicron spreads and we get more evidence that this variant is more contagious but not necessarily as dangerous, the hospitalisation number is the really important figure for us. There are currently 26 people with COVID receiving care in our hospitals. This represents 1.3% of our active cases. 12 are in Alice Springs, 10 are in Royal Darwin, 3 are in Tennant Creek Hospital and 1 is in Gove District Hospital. Across the territory, 11 patients are considered acute and 2 are in ICU. One of our ICU patients is at Alice Springs Hospital and their ICU admission is not related to their COVID result. The other ICU patient is at Royal Darwin. Their condition is considered critical. They are on a ventilator and they are receiving the best possible care. So if one person on a ventilator in the territory, that represents 0.05% of our active cases. To the new case numbers. There are 404 cases of COVID-19 in the Northern Territory in the 24 hours to 8 p.m. last night. Of these, 28 are presumed community transmission, but that number will grow. 113 are from known close contacts, 30 are interstate arrivals, none as yet are international arrivals, and 230 are still to be confirmed. Of the positive cases, 112 are positive rapid antigen tests, and they will be confirmed with a PCR test. 65% of the positive cases today are people aged between 20 and 39. Yesterday we reported 44 cases of community transmission. That has now been revised up to 49 cases of community transmission. Overall, there were 2,532 PCR results to midnight last night. In all, there are now approximately 2,060 active cases of COVID-19 in the territory. There are 584 identified close contacts. Obviously, we can expect a lot more of us to get COVID over the next few weeks, so I just want to remind Territorians of the process if you do test positive. If you get a positive rapid antigen test, isolate immediately and declare your positive result either through the COVID website or the COVID hotline. If you can, doing it online is easier for you and easier for us too. Let your household members plus any close contacts know so that they can get tested, and make a booking for a PCR test so your result can be confirmed. If you get a positive PCR test, you will be informed by NT Health. You will need to isolate for 7 days if you are fully vaccinated and 14 days if you are not fully vaccinated. As we have in the past, like with the Katherine cluster, we will be implementing new measures as needed to ensure that critical frontline staff like healthcare workers, supermarket workers and childcare workers can continue to perform their essential duties as Omicron spreads. Managing COVID also means making sure our essential services stay open and stay staffed. It is a vital part of our work. Today, a new direction will be issued for essential workers who are considered as close contacts. It will mean that a fully vaccinated, asymptomatic essential worker who is considered necessary for their workplace to function can continue to work provided that they take rapid antigen tests every day that they do work, wear a mask and other protective material as appropriate, and stay isolated for the 7-day period when not at work. Depending on the workplace, there will be other COVID-safe measures in place to reduce things like mingling as outlined in a workplace's COVID safety plan. Some examples of how this will work. Childcare centres must stay open. Every parent knows this. So a childcare worker who is considered a close contact but not symptomatic can continue working while wearing a mask and getting tested if they are necessary to keep that childcare centre open. If a nurse at RDH is considered a close contact but is asymptomatic and continues to test negative, they can continue working while observing all the other safety measures they already have in place, like PPE. A close contact supermarket worker can keep working while testing negative and being asymptomatic, so long as they are wearing their mask and staying away from common areas like break rooms. I just want to reiterate, this only applies if you're an essential worker and you are needed in order to keep that workplace functioning. And these are the things that we have actually done before in the Northern Territory in specific situations, like for example the Woolworths in Katherine. Also today, the lockout for most unvaccinated people ends, and in its place, the new vaccine pass requirements begin from noon. So when you're entering certain venues that are higher risk, you will need to show proof of vaccination. Their venues are pubs and clubs, casinos, restaurants with a liquor licence, cinemas and theatres, and ticketed events for more than 500 people in urban centres or more than 100 people in non-urban centres. If you have got your vaccination certificate linked to the Territory Check-In app, that is your vaccine pass. You don't need anything else. Just show the green tick when you enter a venue and you're good as gold. If you are not fully vaccinated, that means you're not able to enter these venues. That is the law. It's not our hospitality venues that are responsible for this law. We are. Don't blame them, blame me. Don't whinge at them or abuse them or threaten them. The police will have very little patience with people who are making our hospitality workers feel unsafe. Don't try it on. There are 2 communities that will have the lockout continue. They are Yuendumu and Yulumu. We've had 15 cases, positive cases in Yuendumu since Friday, 10 this morning. We had 22 close contacts identified, and all new cases have come from that cohort. Despite all our efforts over many, many months, Yuendumu continues to be a low vaccination community, and sadly we are not seeing the numbers increase in any meaningful way. The reality is a large portion of the community are continuing to make the choice to stay unvaccinated. We have vaccines there. We have 15 health staff on the ground. We have surged more health staff into the community, and we have another dedicated vaccination team heading there. But because people are not getting vaccinated, we need to slow the spread and get as many people tested as possible. This means unvaccinated residents in Yuendumu and Yulumu are still in lockdown for the next 5 days at least, and they may only leave the home for 4 reasons: medical treatment, including testing and vaccination, for essential goods and services, for an hour of exercise while wearing a mask, and to provide care and support to a family member or person who cannot support themselves. And finally, it is an exciting day for kids and for Territory parents who have been worried about their child's exposure to COVID. Today, children aged 5 to 11 are eligible to receive their first jab, and more than 4,250 Territory kids under 12 have got a booking in the system, which is a fantastic start. I know this is a huge relief for a lot of parents. We would love to see as many kids as possible get their first jab before school goes back. So please hop online and make that booking. Like everywhere else, we are riding the Omicron wave. It is a big wave, but it won't last forever. We just have to hold firm, keep doing the right thing, keep staying safe. We will ride this out together. Thank you.
Thank you, Chief Minister. So I want to also thank a whole lot of people over the weekend, many people coming forward to be tested. That's what we'd like to see. And also, again, people who are coming forward to be vaccinated. And importantly, as the Chief Minister has announced, we're going early with our 5 to 11-year-olds. Really important as well. So there's been a lot of work done over the weekend, and we had AHPPC meetings both days, and a whole lot of other meetings and work around the directions. And to fine-tune it, we've done this before, so I think people understand what the principle is, and it's also important that we adjust our controls. So we've had our lock-in, and then now we've got the vaccine pass. Now this is really important, that you need to understand that this is a law, it's a public health order or a direction, and it's to protect you from being infected, from others, but very importantly, it's actually to protect the staff, the workers in those places. Now, there is a work health and safety national law where the business owner and the manager and supervisor are responsible for harm being done in the workplace. So this is serious, and you need to take it seriously. And I want to congratulate the businesses that are already asking for this information, even though it wasn't required. And if I could apologise for the inconveniences that we're going to see in Yuendumu and Yulumu. I've been to those communities, and yes, there is significant under-vaccination rates. It's complex, and I had a meeting with many of the community. It went on for a good while, but this is the consequence now. We've got a number of people positive. They may need to further transmission, and I'm going to say it, the loss of life. And that's important because our first death in the Northern Territory was an Aboriginal person. So this is the additional controls that we have to put in place. And this also is a direction and a law. And so you need to understand why we're doing it, particularly to get more testing done, but also to work with the community and the community leaders to get the vaccine status up, the numbers up. So again, the Northern Territory, despite our large geographical size but a very small population, we're going ahead with some systems such as the notification and registration of rapid antigen tests online. Some other jurisdictions are starting to think about this now. So again, we continue to improve things, but in the end, this battle is not over. The war certainly is not over. So I want you to take care of yourselves, be safe, and I know that you'll get sick of me saying this. Don't forget public health principles. Don't forget mask wearing indoors persists in many venues. There may be other controls in the future we've talked about, but don't forget your physical distance does make a difference, and please do not go and mingle, go out if you have symptoms, respiratory symptoms particularly. So thank you everyone, and stay safe.
Good afternoon, everyone. Firstly, I'd just like to thank Territorians during the lockout. Really important work that's highlighted by the Chief Minister and the Chief Health Officer to protect our community and to protect lives. Out of the last lockout area, we've had 48 referrals for non-compliance. 14 of those have led to investigations with 7 infringements issued for failing to adhere to a show direction. As we lead into the next stage of the vaccination pass, really important that everyone shows respect and some tolerance during times where you'll be questioned to validate your vaccination status. So please be respectful, show some tolerance, be patient, and just be kind to one another to get through this and protect our community. On matters of emergency management, you'll know that Tropical Cyclone Tiffany is expected to enter the Gulf of Carpentaria tomorrow. It's expected to move through the Gulf and possibly impact Root Island as a Category 3 cyclone on either Wednesday afternoon or Thursday morning. Please make sure you look at Secure NT, make sure you're across all the data, the emergency services portals, have your cyclone kits ready, make sure you've got batteries, make sure you've got radios, make sure you've got the provision of food and water, make sure you tell your family where you are. The Emergency Operations Centre is currently stood up at the Nightcliff Police Station. The Regional Controller is undertaking those duties with the Deputy Instant Controllers. Local controllers across the Northern Territory are engaging and communicating with community. The Cyclone Watch has been issued from the Queensland-Northern Territory border right up to Nhulunbuy. Please, now's the time to think about your movements and preparation. Not tomorrow, not later this afternoon, right now. Get prepared, know your movements, act now, so when the time comes, you are prepared. Stay tuned to the broadcasting, emergency broadcaster. Stay tuned to the platforms you rely on to get the information. And most importantly, look after yourselves and each other. Thank you.
Chief Minister, I guess if we can just touch on, this is a clarification, the Yuendumu and Yulumu lockout, is that indefinite at the moment?
5 days.
5 days, sorry.
So from noon today for 5 days, at least 5 days. The priority is obviously testing. We've seen in Western New South Wales and in the Northern Territory in places like Binjari an immediate vaccination response when there's a positive case. We haven't seen that in Yuendumu. Obviously, if you twin vaccinations with testing and the trapping, we know we can get on top of something quite quickly. We are worried in Yuendumu that there has been no uptake in the vax. There's vax available. Basically, there's been no additional vaccination. So it really puts all the pressure on testing and trapping, and so the lockout is quite important to that. So far, trace and trap has worked. So we identified 27 close contacts early doors, and the positive cases have been within those close contacts. So far, the testing and tracing is working within the community, but we're going to maintain that lockout so we can keep that testing presence there and the pressure there.
Would the close contact rules being introduced today apply to close contacts in Yuendumu as well? They could still go, if they have worked in an essential supply line, they could still go about there.
And this is probably a really good example of why we need this. If you think about a remote territory community, you're not just going to want to flood a lot of extra people into a remote territory community. You want to put the right people in. You might have a small community store. If you're an fully vaccinated, asymptomatic close contact and are needed to keep that store open so the community can stay fed, then we want to be able to work with you in that setting. We've done similar things in the past in the Northern Territory. So in the past, we've done it obviously within a lockout, lockdown area. And you might have Catherine, for example, and the Woolies there, or healthcare staff there. We're obviously moving to a position now in the Territory where there's going to be more cases all over the place. So this is a territory-wide direction that gives us the capacity to have the confidence, or gives us the confidence that we'll be able to keep those essential services going where they need to be going.
In terms of regional cases, you mentioned how it's popping up all over the territory. Do we have a regional breakdown of each area, or how many cases popped up in each of these 4 areas?
I don't have it in front of me. We have got that, so I can get you a feel for that. All I'll say to you is the overwhelming majority is in the Greater Darwin area, so it's not quite if you want confidence, most of them are in Darwin.
Chief, in Queensland, they've decided to delay the school year by a couple of weeks to allow the vaccine rollout and to prevent going to school during their peak. Is that something we're considering in the Northern Territory?
So at this stage, we're obviously still planning and working towards the day of school term being the day of school term. Our understanding, with 3 weeks ahead of us, every student in Northern Territory will have a chance to get vaccinated before school starts, so we don't need the extra 2 weeks. We're also discussing that in National Cabinet this week, so things, as we always know in COVID, never say never, things can change. But right now, we're all planning for the start of school term where it should start. So for parents out there, planning with confidence, teachers, we're planning with confidence for school being on that date. Vaccines arrived today. We've already got 4,200 kids booked in. You can also obviously go through your GP or a pharmacy, is my understanding. But we're on track to essentially have every student have the ability to be vaccinated before the day. Obviously, you need parent permission, but we have confidence we can get most of those first doses in before school starts.
Dilber mentioned that they're expecting vaccine supply for their 5 to 11 by Friday. Still didn't come today, and so that's pushed back their rollout to, they're hoping, Wednesday. What's the story there?
Well, that might be a question for Dilber. So we've got our supply. And so we're ready to go. So I don't know why Dilber wouldn't have theirs. I can follow up.
Provided by NT government today?
I thought they got supplied directly by the Australian government. We have done vaccine sharing in the past with Dilber, so I can double check that. But well, put it this way: we're going today, so we've got our vaccine supply in time. We've given lots of stuff to Dilber in the past, so I can't see why we will be an issue for Dilber. Might be a question for them why there's been held up. I can follow up through General Fruin and others as well, just to make sure that's cleared away. But we've definitely got our vaccine. We're going.
Chief, a question for you and also the Commissioner. What's your reaction to the protesters today at this business in Darwin who were closed down on Friday? What's your reaction to them and to you, Commissioner, once the Chief has finished your reaction as well?
It takes 15 minutes to get vaccinated. I think for me, just have a great sense of frustration where we are 2 years into a pandemic, or close to 2 years into a pandemic. We have this, quite frankly, a miracle in front of us. The idea that within 2 years you get a vaccine and that it would be free and that you could get it and it will take 15 minutes and it could help save your life, it help save the life of a loved one or a stranger. I think this is a really straightforward, simple thing that we are asking of people. Now, you can choose not to be vaccinated. I've said in the past, I don't respect it, I don't understand it, that's true. But you can make that choice. That's your choice. You can make that choice. Occasionally, we're going to have decisions that will impact on the unvaccinated versus the vaccinated because you are at greater risk if you're unvaccinated of catching the virus, spreading the virus, or being severely ill to the virus. So we're going to have to make these decisions from time to time. Now, the lockout that we've just been through is a 4-day lockout. I think it was a very short lockout. I don't think what we asked of them was onerous. The CHO obviously thinks about these things quite carefully. It was in place, it was there. It was, in my opinion, an extremely simple thing to abide by. So, my anger is abated. I can't sustain an anger, if that makes sense. I was angry. Now I just say I'm simply frustrated. These are very simple things we're asking people to do. I know you don't want to be vaccinated, but we are making decisions on behalf of Territorians, for yourself and for others, to try and keep the Territory as safe as place as possible. So for me, yes, we're going to ask of Territorians things that are going to be inconvenient occasionally. And we've done it for over 2 years. And Territorians have sacrificed. I think Territorians are absolutely the best. I'm getting increasing feedback from Territorians who've been down south in recent weeks that compliance in the Territory for things like the mask mandate are sensational. And down south, you might be lucky for 1 and 2 people working in a cafe to be wearing a mask and stuff like that. Like, Territorians have always risen to the occasion and have been magnificent. And I just think it's sad when a few Territorians let the ship down. I'll let the Acting Territory Controller add to that.
Thanks, Chief. So to answer your question, the show directions are law. The police force is responsible for the enforcement and upholding the law. As far as the infringement notice I issued, or we spoke about earlier with the 7 in the last 72 hours, 3 of the infringement notices were actually issued to 3 of the members of the associated business at Coconut Grove for non-compliance with a show direction. It's simple. The Chief Health Officer, Dr. Hegge's already said this. This is about public safety. It's about saving lives. Going to the point on a protest, everyone has a right to protest, voice their concerns or their position, as long as it's peaceful. We were there this morning at the protest with health officers to ensure there was compliance with the Chief Health Officer's directions. It was a peaceful protest, and it only lasted for over an hour. There was no issues from Northern Territory Police.
But hold on, aren't some of those people at that business posting about being unvaccinated? So how could they have been outside at 8 a.m. in the morning when the lockdown was still in place, but people were unvaccinated?
But in saying that too, obviously there's some inquiries that need to be undertaken about lawfulness, satisfying the reasons to leave the house, answers. Everyone's got a right of reply. So that's Op Crown is our enforcement arm. So they'll obviously have some conversations. But as far as the protest or congregation was concerned, they were compliant. There's no issues from Northern Territory Police at this time.
In terms of the vaccine pass, it's maybe one for either the Chief Health Officer or Chief Minister, but just to clarify some other venues, gyms, schools, and I'm talking about people 16 plus here, and community halls, things like that, still able to attend by the sounds of it?
Yeah, so to talk to the principle of it, we've tried to go for places that have essentially an easily controlled entry and a high risk. So the 2 highest risk places for catching COVID are your home and hospitality. And this essentially addresses that. We're not going to require, sorry, I got in the habit of talking through the mask. We're not going to require a vaccine pass for people's homes, but we are going to require a vaccine pass for hospitality settings, which are considered the high-risk settings. So the focus has been on high-risk settings. I'll pass to the Cho to discuss that. So these are the ones that we are focusing on.
Thank you, Chief Minister, and that's a good question. I would like to respond to the last question though. It was members of the public who repeatedly reported the behaviour at that business. So to be clear that it's the public's concern about the risk that was posed. So the evidence is that it is, as the Chief Minister said, in households and in hospitality, and that's where the biggest risk is. And I think that we need to consider when we go out what the risk is. I want you to go out. I want us to be leading a normal life, but it may mean that you have to wear a mask as we have at the moment, but also the vaccine. I mean, the Northern Territory has done better than every other jurisdiction. Our numbers are creeping up, and proportionately they actually are concerning. Now there's a slight downtick, and that's a good thing. But the most important thing you can do is get vaccinated because it protects you from serious harm and potential death. So look after yourselves, look around you, the behaviours, but we need to normalise our lives, but with public health behaviours in place.
Is it likely that we'll see the booster shot built into the vaccine pass at some point? And at what point would we do that? I know that Congress are interested in seeing that become a reality.
Yes, so that's also important, that we want evidence of our vaccine status. So the technology is available, I believe. I want to be clear that this information about your vaccine status is not actually held at all by the venue you attend. It's not. The vaccine status is something that we're interested in, not so much in the individuals, but how many people are vaccinated in the community. I think that there's other controls that we need to consider in the future in addition to the vaccine status of people. But please, again, it is a law, and that's been signed by me earlier, and I want you to follow that rule.
Those controls that you just prefaced there, we've seen in New South Wales they've reintroduced density limits and also temporary bans on nightclubs, singing and dancing. Is that something on the cards for the Territory?
So that's an interesting question, because you may not know, but we didn't go with any of that in terms of density and singing and dancing. We actually looked at the risk, and we went through principles and the risk of transmission, and we don't have the very large venues that other places have, but we maintained for a very long time, no COVID here. It comes from interstate and ultimately from overseas, that we managed to get the economy and people enjoying their lives. But now is the time to actually consider what other controls that we might put in place, and that could be that there are density limits, and we certainly have controls around mass gatherings. And there is evidence that if you are dancing, then you may not be aware of others around you. But then I considered traditional dancing, including Aboriginal dancing. Would that not be permitted? So you have to always think about the consequences of making a law in that way.
Sorry, just if we can return to, and I know the Chief Minister raised his hand, but just about that third shot, where that comes into the vaccine pass, if it does, and what the government's thinking is there.
So at this stage for the vaccine pass, fully vaccinated will be 2 shots. We are looking at the simplest way of including the way of tracking the 3rd shot. That'll be the vaccine pass, and for the vaccine mandate around workers as well. We just want to make sure it's practical and easy to implement. That obviously takes 4 months to be eligible for your booster, so we've got a bit of a 4-month window to work around here and how we look at it. At the moment, we obviously take our information from the Medicare app. As I understand it, practically a Medicare app's not formally looking at that yet, and ATAGI hasn't made the decision around the 3rd dose. I think there's a few triggers that need to be happening there to implement to impact the Medicare end, which will make it easy for us to implement. So it'd be the intention, but we're not necessarily going to do that bit yet. I just want to make sure it's practical and easy at the premise. So at this stage, you'll be around the 2 doses.
Hospitality venues will be concerned about, because there are some people who are very much against getting vaccinated and have made a bit of a job of theirs to almost do these performative actions where they will go to a venue and make a big song and dance about, I'm being denied this, that, the other. Yes. So what's going to be an actual enforcement that police can get there quickly to enforce this stuff and protect these venues, and particularly staff?
So I'll start, then I'll pass to the Acting Territory Controller. We've deliberately drafted a direction, so a premise must take reasonable steps, but the onus is on the individual. So the individual must not enter unless they're fully vaccinated. So we recognise the pressure to go on to a premise or to a person at that premise. We don't want that. I understand exactly what you're saying. I think it is, there can be people out there who can go too far. I think I used the phrase impolite the other day. They can be quite aggressive and rude at a premise. So we recognise the potential for that. So we're saying to a premise, you must make reasonable steps. But the onus is actually on the individual, and I know the Territory Controller on Friday just said, call us, we take it seriously and we will respond. So that might at that point pass to the Acting Territory Controller, send that same message. We get it. All we're asking of you is be reasonable as a premise. The pressure and the onus is actually on the individual to do the right thing.
Thanks, Junior. Yeah, so predominantly it's about education doing the right thing, personal responsibility. The message is pretty clear in community. I've met with Hospitality NT. If there are people who are annoyed or become frustrated, that's okay. You get annoyed and frustrated from time to time. But if you become quarrelsome, you become threatening, you threaten to assault someone, there'll be an intervention by Northern Territory Police. And there could be an associated fine with that or other criminal behaviours you'll be held to account. We do ask everyone to ring the 131 444 police line when they feel concerned. So it's about education in the hospitality industry and all the essential workers, but it's also education on the people that they control themselves, moderate behaviour and be tolerant and compliant.
Just on the close contact, changing those definitions, is there any fears at all around the close contacts we've seen can often eventuate into cases and maybe don't get picked up by a rep? What was the thinking to allow for asymptomatic close contacts to continue about their business?
So it's based off our practical experience, having done this before. So for us, it's looking at where you need that essential service to keep operating. So it's the balance of risks. Obviously in Catherine, if you remember, we had the Woolies there was a frequent exposure site and the hours kept jagging quite dramatically and shrinking a lot. But obviously you've got to make sure a place like Catherine gets fed. It's got that one big supermarket for all the people in Catherine. So it's about assessing the risk and managing it. And a fully vaccinated, asymptomatic close contact who has taken a rat test that morning and is masked is considered a very low risk. So for us, that low risk balanced out against whether you're keeping the lights on or the childcare centre open or the supermarket open, that's where that balance probably is coming. We've done this before, so it's about putting in a territory-wide direction that allows that to occur. And I'll ask the Cho to talk to how we assess that risk. This has gone through HPPC as well, so it's not just us.
Yes, that is correct. It's been discussed and agreed at AHPPC, and part of the reason is because of time and availability, appropriateness of the use of PCRs. So the symptoms are the most important things. When I talk about symptoms, we're talking about respiratory symptoms, not a headache or feeling muscle aches or feeling tired. It's about sneezing, runny nose, a cough rather than a scratchy throat. They're all the symptoms that you might actually be communicating to others, but noting that you'll have a mask on at the same time. So this is evidence-based and also work done around the country to allow the life of people to be sustained, supplies of appropriate goods to be sustained, services. And all of these are taken into consideration, and that work was done again to refresh that list of essential services over the weekend. So I think it's important that the approach that we've had has held us in good stead in protecting the territory and those who come here.
In terms of there's a potential exposure to bush bus that was at Yuendumu and now come back to Alice Springs. We understand, or the ABC understands that it's not undergone a deep clean. Is there any concern that that may be potentially a problem?
The Cho talk to this. My understanding, the level of cleaning that's required has changed dramatically over the 2 years of the pandemic. So if you go back 2 years, what people thought they needed to do to clean something has now changed. Essentially, you just need some bleach. But the Chief Health Officer talked to that. So the idea of a deep clean, I think, has dropped off as a necessity as it's been previously understood.
Indeed, that's a good question. It's about how we clean our homes as well. And in fact, after people have been there. So it's very simple. It involves diluted bleach to kill the bacteria, because that's what chlorine does. And it's used in swimming pools and in drinking water as well. The second is some scrubbing to make sure that there's any particles that have been removed. So it's not complex. It doesn't take very long to wipe over and scrub areas where people may have actually touched, noting that they should have been wearing a mask as well. Thank you.
Health
Last
staff,
couple, please.
15 have been sent to Yuendumu. You mentioned that surge staff. Do we have an idea of total figure of people being deployed to Yuendumu?
So there were, I hope I get this all the right round, there were 7 health staff already in Yuendumu and 8 have been sent out additional to that, and there are 7 police on the ground in Yuendumu. So between health and police, there's 23 staff on the ground in Yuendumu, and a further vaccination team is going out. I'll double check how many is in that team. So there's a large presence on the ground, and the priority obviously be testing, because we have not seen a vax tick there, unfortunately. So the priority will be around that testing regime and seeing how that goes.
Binjari was perhaps our most concerning outbreak for some time in the Territory. Chief Health Officer, I wonder, does the outbreak in Yuendumu compare to it similarly, particularly given the low vaccination rates?
So this is a challenging question, because I don't know. I don't know. It's true they're quite different. We're talking about one very small community and people who travelled from that community or travelled to that community. Some of the behaviours that contributed were, can I say, inappropriate, because people who try and bypass checkpoints is not really the spirit or indeed respect for the health and ultimately the death. So at the moment, the approach here is to actually test as many people as is possible, given that we've seen this sudden appearance, and that's the most important thing. We're talking about something that's just happened, and I think the approach here is entirely appropriate. And indeed, this will be our approach in the future when it comes to communities or even suburbs or streets, as we've done before. So please be patient with this. I still have got my concern, because in amongst that group, and it may be people who've chosen not to be vaccinated, I did actually talk to some when I was there a couple of months ago. You potentially are risking your own lives. And I'll say this, the loss of storylines, song lines, dance lines, a whole history of things that may be lost, particularly people who are older or got other comorbidities. Thank you.
Any more? All
Do we
good?
know how many people in the hospital who are infected with the virus are unvaccinated? Do we have any numbers?
So it's,
on that?
I mean patients?
Yeah, patients.
I'll have to take that on notice. I've asked for vax unvax status from 1 January, and they're still compiling some of that information for me. So I might not be able to get you that today, but we are working on that.
And will that be a territory-wide thing too, or just tailored to?
That would be for people in hospitals, so that would be all hospitals in that situation. I knew the ICU, I'm not sure if it's still the case, but I knew the ICU status last week, which was 1 unvax, 1 vax. I'm not sure if that's still the case, if it's still the same patients in ICU.
Yes, the one that's critically unwell was vaccinated, but an older person.
So, I'll take that on notice. We are working on that separately, getting all that information as well. Thanks.
Yeah, and just one more. What vax numbers are you realistically aiming to achieve for the kids going back to school in 3 weeks?
So it's available, so I wouldn't say that's a KPI, if that makes sense. The start of school term will be based off us seeing a certain percentage, but we believe with the 3-week lead up to school that everyone will have the opportunity to, every child will have the opportunity to get vaccinated. Is what we're aiming for, making sure it's available to all. Right. Thank you, everyone.